Come on through, Jeffrey. So we had a chat about this yesterday.
Yes.
Saw you in November, December, when you had this sort of tightening of the foreskin.
That's right.
But you could get it back, and I referred and it got rejected.
Correct.
But since that time, it's got worse.
Definitely.
And what can you do? Can you retract it back to go for
Not
a
at
wee
all.
or anything like
Not
that?
at all. There's no retraction at all. Mm-hmm. And it's getting a little bit embarrassing because obviously there's no direction.
So does your wee come out in
Yeah,
a... does it spray at all, or...?
Yeah.
Okay, okay. And has there any skin change on the tip of the penis that
Yeah,
you can see?
there's colour change.
There's a colour change.
Yeah.
And when did that develop?
Well, it's been developing since it hasn't been able to retract.
Yeah, yeah, okay. Sorry, Jeffrey, I just
That's all
need to... Can you see what you can retract yourself?
Yeah, sure. There's nothing at all.
There's a whitish skin change there, though,
Yeah.
isn't there? Yeah, fine, okay. And let you pop your things on and get dressed. That's okay. I think you've dropped a couple of copper pennies there.
Oh.
Right. Well, obviously it needs sorting out. I think what's going on is something called BXO, which is a kind of skin condition that over time in your sort of age group leads to just the tightening of the foreskin, exactly the kind of symptoms you describe.
Yeah.
And so that needs acting on pretty quickly, actually. Haven't seen a case for a while, actually. BXO stands for balanitis erotica et obliterans, and it causes thickening of the foreskin and depigmentation. This presents with symptoms of poor stream when you're passing urine and pain during intercourse. It's relatively uncommon, we don't see it very often. Medical options are using steroid creams, which sometimes help, but unlikely in cases where they're occurring in older age groups. Usually the definitive treatment is surgery, which is often a circumcision procedure. Does it itch at all?
Every now and again, I get that really it itches inside.
Yeah.
And you can tell it's quite hard skin at the top end.
Try and keep the area dry. The other thing is just to book in for some blood tests. I just want to check your sugar level and a few other bits and pieces because you haven't never really had any blood tests.
No.
So if you take that along to the treatment room, they'll book you in.
Yes.
I'll speak and sort out the urology referral again.
Yes.
See what we can do, but it's more urgent now.
Yes.
Remind me, do you smoke at all?
No.
You've never smoked?
I gave up when I was 10.
You gave up when you were 10?
Yeah.
Should I ask how old you were when you started?
About 8.
Were you just trying it or smoking proper?
No. My friend and I used to go down to Central Park in Plymouth.
Right.
Because my dad was in the Navy, so there's 60 a day, so there's cigarettes everywhere.
It was
So
freely available.
we used to just go into the park with a packet of 10 and a bottle of lemonade.
Then muck around.
And then when I was 10, Steve decided to drag one down, and I thought, no, I didn't like that.
Didn't like it, so it put you
gave
off
up.
for life.
Yeah, definitely.
OK, well, there we go. All right, Jeffrey.
There's not too many people who say that.
No. I'll speak to you a bit later.
Brilliant.
All right, we'll get that sorted ASAP.
Lovely. Thanks very much for that. Brilliant.
Take care.
Thanks a lot.
Bye.